Standing on the edge of a cliff, realize there must be more to life than this. Reaching for the stars, traveling so far, like a dragonfly. Just grab my hand from heaven's send with me tonight.
My channel is about all things chronic illness, so don't forget to like, comment, and subscribe. Hey guys, happy Thursday. So I just got home from my Mediport surgery. Everything went well. When I got out of recovery, like nothing hurt except for my ankle on my right foot. Don't know why. But after getting dressed and now home, I guess like the numbing stuff is starting to wear off. So he put it on my left side because he couldn't do the right side. And it has a protective glue over it. I can take a shower tomorrow. I just can't get it like saturated soap. So I normally just cover it. My husband's making me grilled cheese so I can take my other medicine, and I'm about to take my medical marijuana and a Finnegan. But yeah, it's starting to really be uncomfortable. I guess everything's wearing off or whatever. But I'll keep you guys posted. Today's just rest. I mean, it even hurts down to my arms. So when I got there, I had to get blood work and an EKG, which was kind of frustrating because I'm there for a Mediport. So they stuck me twice for the blood work. Then when I got back to get the IV, they stuck me 3 times just to get that. But everybody was super nice, super sweet. I do have a power port. I haven't went over any of the paperwork because they gave it to my husband. So after I eat and take a nap, I'll read all of that and I can show you guys everything. Hey guys, happy Friday. Hope everybody's well. Last night was like, I didn't really have any issues. I mean, I'm really sore. And I pretty much slept in this spot just like I am right now. I just got out of the shower. I had got up to eat and threw everything up. So after throwing up, felt better. But I got in the shower and I'm like out of breath. Just really uncomfortable. My husband just got back. He went to pick up my prescription. Not sure if I'll use it. I just did my marijuana. I was really consistent with trying to do that every 4 hours. But I think like this morning I did it at like 6 and like I've been asleep, so kind of got off schedule. Just trying to take it easy, not stressed about anything, no emails, no phone calls, no text messages, social media, nothing. Hey guys, it's a little bit later. Forgot to come back on. My husband changed my dressings. Everything looks fine. I just can't stop throwing up. So earlier when I had lunch, I threw all of it up. And when I'm eating, I feel like the pressure, like it hurts all the way into my arm and my chest. But after I throw up, I feel better. So then went back to sleep, took a half a Finnegan, woke up and I was, starving, and I had some roast. Same thing, threw it all back up, and then I'll feel better. And yeah, so I don't know what's going on. If it continues, I'll have to call them to let them know. I just don't know what it is. Because I ate crackers earlier and I didn't do that. So I'm really not sure what the reason behind it is. So I'm just been trying to take it easy. So like it's extremely like my clothes touching. It is very uncomfortable, but my chest is so sore from the throwing up and the dry heaves. But I'm just taking it easy. I just took my Finnegan and my night dose. My husband did pick up, like, they gave me like 5 Percocet, but I didn't take it, any of them, because with vomiting and a lot of times narcotics make you a whole lot worse. So it's over there. Okay. So that's the neck one, and that's the chest one. It looks kind of, but that's like the glue on top of it. That looks kind of weird, like it's wet, but it's really not. Um, but yeah, like all of my arm hurts. I'm having to like prop my left arm up on the pillow now, where I wasn't having to do that before, just to get comfortable. So yeah, that's where I'm at right now. Just gonna take it easy. Uh, and by Monday, I should be hopefully back to myself. I just want to know why I'm throwing up. Um, like, I guess I would have expected that the day of, maybe, from anesthesia, but after, no. Like, and I'm taking my protonics, um, for like acid reflux, but like the pain will be so intense in my chest, and it goes like to like right here of my arm. And when I tell you, I just be doubled over. Like, it's no stomach cramping, nothing like that. It's just intense. Like, yeah, it's just so weird. Um, but if it does happen again, like I said, I will tell the doctor. Hey guys, happy Sunday. Hope everybody's well. Um, I got up this morning, made me an Easter breakfast. Like, I did an egg and cheese sandwich, and she had grits with egg and cheese. Felt really good. I wasn't up long, but I started to lay back down because like I keep getting these like headaches on the left side into my neck. It's really uncomfortable. The incisions, can't really see, but they're doing fine. Just it's just taking a little bit longer. For the average person, like, you get a Mediport, a lot of people use their Mediport the very next day, especially like if you have cancer and you're doing chemo. But with lupus, it takes us a couple extra days to start to feel back, to normal. But my last dose of CBD was at like 6, I think, this morning. So I'm about to take the THC tincture because I'm just uncomfortable. And I've been laying here trying to get comfortable and I can't. Having the pregnancy pillow, like I've said this before, has been like a lifesaver when you have chronic pain and joint issues and not getting comfortable at night. The different ways that you can use this pillow has really been helpful. So you can see I have a bruise right here on my arm, but all under my arm, of course, my chest is extremely, extremely sore. And even the clothes touching, like, for long as I'm doing like this, to try to like puff up underneath so it doesn't like rub my skin. But I used my pregnancy pillow arm, right under here, and I can fall asleep a lot easier. And it helps with the discomfort. And this side, like, it props my pillow up, And if I need to sit up, I can put this behind like my pillow and prop me up a little higher to give me some more support. But yeah, my throat's really sore. Like, I'm just kind of swollen, which is to be expected. So I just wanted to give you guys an update. Excuse me. My husband's already gone to practice, him in Austin. It's gonna be a busy day. Like, they left at like an hour ago. It's like 12:30. So they left at like 11:30. He has to set the track up. He had to go pick up a couple athletes. He had to go get ice. He has to start our tiny tots at 2. I'm thankful for my husband, because I know he's tired. Like, last night he just crashed, because between dealing with me, Austin Easter, track, his own self, like, it's a lot that he has on his plate. But yeah. Okay, guys, I'm trying to get out to get an Easter something to eat. I just got out of the shower. I'm so uncomfortable. Can't put I didn't put a bra on. I put on like a little camisole. Because the strap would literally go all the way over here, so I didn't want to chance it. I feel like I'm gonna throw up. That's in my head. So I'm trying to see if that'll help with my headache. My eyes, I feel like my eyes closing on my left side. I don't know why, but it's all swollen. Jesus. Just gonna pray that we make it safely. I'm going to Sonic's, which is still not far, but I'm trying to go a direction that I don't have to do but like 1 or 2 turns. Yeah, my eye is doing, like, my whole side of my face is like. Hey guys, so it's later. Just got out of the shower. My incision on my neck, I have like a knot right here. It wasn't there earlier. I guess I just did too much today. It's uncomfortable. My head still hurts on this side. So if it's still bothering me, tomorrow I'll just call the office and see, is it anything I need to be concerned about? Because it's like, right now, like a pea size, and it's hard. But yeah, the bruising's coming in more. Hey guys, happy Monday. Hope everyone is well. I am heading to the surgeon's office. He was in surgery this morning. I talked to his nurse about the knot at my incision and the pain that I'm having. So they wanted me to be seen. So I'm not sure if they'll do like an ultrasound or an X-ray for placement. I have to go by Walmart and get my lidocaine. I'm so upset, which is healthcare, not the surgeon's office. They haven't done anything, but like my rheumatologist called in the lidocaine for when you access the port, so it's not so painful. So they did that on Monday, and I've been waiting since Monday, and they kept saying, oh, we gotta order it. So I told the girl today, I was like, hey, did it come in? And she was like, well, you probably have to just go to another Walmart store. And I was like, ma'am, my doctor called this in on Monday. I've never had to wait this long for you guys to order something. And I said, I just had surgery Thursday, and I'm having to go. And I'm pretty sure they may access it today to make sure there's like nothing that's clotted off or whatever. And so she was like, hold on, let me just go check something. So she ended up taking the, she checked the shelf, and they still had one on the shelf, but the system was saying that they didn't have it. So she went on ahead and put it as if I was in the store. So like within 30 minutes, it was ready to pick up. So I'm going to get that, and then I'll go straight to the appointment. But I wanted to be as prepared as possible if they decided they needed to access anything today. I just want to be prepared. But the entire left side of my neck hurts in general, but like this is a difference. But this whole side, like it hurts my eye to be open all the way. It's just weird. And it could just be the stress of everything that my body's had to go through. And then I have to also, a lot of stuff, like my husband, he's the one, like normally he'll just be like, no, I think you're going to be fine. But he was like, no, I think you need to call the doctor. He found the discharge paperwork, and he was like, yeah, I think you need to call the doctor. He said, because it says if you get any kind of swelling, it could be an infection, and, so he was like, you need to go get checked. Because I think I would have fought through it. But then at the same time, what if it is a something like misplaced or a clot or something? I mean, that could be really dangerous. And I would hate to just try to chalk it up to say, oh, I'll feel better eventually because of my lupus kind of thing. So yeah. Alright guys, so left the doctor. He's concerned that I could have an infection. He said he can't really tell because it's extremely red. And I told him it wasn't this red originally. Oh my God, but he kept poking and squeezing, and it's uncomfortable. So he's calling me in some antibiotics. He wants me to come back. He said next week if I feel like I still need to be seen. But I'm already scheduled like on the 24th or something. So he said if I'm good, next week, don't worry about it. I'll have to find out how many days of antibiotics that I'll be on to see if that's going to affect it's going to affect me from having my neck procedure on Friday. I'm not happy. I know he squeezed this thing and it hurts so bad. He said he didn't need to do an x-ray because he uses ultrasound. He said that I cannot have anything else on this side because it pretty much clotted. So I'm like, a clot, like, do I need to be concerned? But he just says it pretty much just like your veins just kind of branch off to new veins. It like goes around the blocked area. So he would recommend I never get anything over there again because they're going to have problems. And then I told him, I said, well, I remember when they put this one in and was trying to take it out, I said, I bled a lot, and I wasn't even under, real sedation then. So it was very, very traumatic. So, yeah, y'all, I don't know. With the darn, possible infected site. So, at least he's catching it. Because it's all behind my ear and my head. It's just throbbing. It feels like I have a sore throat, so probably is. Alright guys, so I'm done at the neurosurgeon. I guess I'm just in a foul mood because I don't feel good. Tired of dealing with doctors. So I went in today. I don't even know why I had to go in. Because I don't have the injection until next week, and I already knew what the MRI results showed from the other doctor that's in the office. So they're going to go ahead and do the procedure. I don't have to wait, since the antibiotics are prophylactic or whatever. So they want to start with this medial branch block, and then if it works, then they'll do radio frequency ablation to burn the nerve. And then if it doesn't work, then they'll talk about proceeding with surgery. And I guess I'm just at a point to where I'm just so tired of being poked on, giving steroids, not giving steroids. My body is just a lot. And I get it. Do I want to go through surgery? No. But at the same time, I'm ready for this case to be over. and I just want to feel better. Like I told him, I was like, I'm tired of my arms feeling like they weigh 1,000 pounds and they're tired all the time, and the discomfort, and I just keep getting these temporary things that are not long term to help me. So yeah, he was like, well, I understand your no, you don't. If you're not going through it, you don't understand the frustration. And it doesn't matter, like, if I was having a major surgery, put me to sleep, full sedation and everything, or if I'm having just a twilight sedation recover, like, my body reacts the same. Like for epidurals and stuff, like, I still struggle just as if it was a major surgery. And I don't think that's what they don't understand. Okay, guys. Got home, I was just tired in general. My head's been hurting. I just got out of the shower, and as soon as, like, I wasn't even dried off, and I just started throwing up again. I don't know what is going on. This one was, like, pretty intense. I could barely stand. And then when I thought I was done, I tried to take a Zofran because it's dissolvable. And I went and I dumped the trash and had to immediately start throwing up again. Finally stopped. I'm scared to take anything else except for I took my tincture to see if that would help, because, like, my stomach started, like, cramping, like, really bad in one spot. I took the dermabond off of that chest incision, but this one is starting to look a lot worse. But I can't really feel any more adhesive on it. But I did put betadine on this. I'm trying to keep it on there with a Band-Aid to try not to let the Band-Aid irritate me. But my skin is just, like, on fire. I'm not sure what's going on. I've checked. I did a COVID test Friday when I was throwing up right after surgery. And my thing is, if it was anesthesia, it normally would have happened the same day. But it's just crazy. Like, I'm trying to eat and I just throw it up. So my husband had brought Chinese, and I had that and took the antibiotic, and I had a Jello. And then I was like, oh, I'm gonna get up and just take my shower. And like I said, I was in the shower and my head was just, like, throbbing, my head and my neck. And then it just happened. Hey guys, I'm at the ER. Well, I've been here for over an hour. I just got put back in a room, so I'm waiting on the nurse to come in and assess me again and figure out what they're gonna do. I don't know. I just don't feel good. I haven't had anything to eat today. So I will keep you guys posted on what they say. Hey guys, so the ER doctor came in and the surgeon just left. They're more concerned about my headaches and the vomiting to make sure I'm not having a stroke or had some type of stroke. This is mostly, he said, contact dermatitis, and I don't need to put any more needleform on it. So they have to come in and do an IV because they can't access my port. Even though I put my numbing stuff because I thought that's what they were going to do. Because he said that if they access and put the dye in the port, even though it's a power port, it will show artifact all in here and in my head, so it won't be able to see if there's a clot or something wrong. I thought more of a stroke on between Friday and Monday than I really, than right now. But everybody's been really nice. So I'm just waiting for them to have me in and try to find a vein using ultrasound so I can get whatever scan that they're doing. I don't know if it's a CT or an MRI, but I'll keep you guys posted. So I'm just trying to stay busy. Working on a few things on my tablet just to pass time. I'm hungry. I'm uncomfortable. But like I told him, I didn't want any, nausea medicine or pain meds or anything like that. I just want to know what's on so I can go home. So I'm back from my CT angiogram, but the rash is getting worse on my chest and my neck. They switched out my electrodes to give me hyperallergenic or whatever. It's not working. They still haven't given me meds or Benadryl like they said. My head is hurting so bad on this side. It's after 6 o'clock and I still have not had any food today. And I've called the nurse, but they still haven't come in. Driving me crazy. So I'm finally discharged, very aggravated. After being stuck 5 times, excruciating headache. The nurse was like, I know you don't want pain medicine, or it's my rash was coming back. It was full-fledged, I was breaking out from the electrodes. She's like, oh, you really need some Benadryl and something, you're here, just, if you can get a driver. So I talked to my husband. He was going to get somebody to drive him to get the car. And so she's like, I'm going to give you this before you go to CT scan. But then CT came and got me. So I was just like, okay, CT's not going to take long. Get back. I wait for an hour. Then I call the nurse, hey, these electrodes, she got some hyperallergenic ones and they were still making me break out. And I was just itching all over. And it was nobody came in the room. They didn't care. And so finally, 2-3 hours later, the doctor comes back and was like, hey, your scan is good. We'll let you go. Just follow up with the surgeon, and he's like, do you want pain medicine? I was like, no, I just want to freaking go home at this point. And he's probably was under the impression that I got my medicine. So the nurse comes in, oblivious to the doctor discharging me with 3 vials. She's like, I'm sorry, 3 syringes. She's like, I'm so sorry. I got 3, critical patients, and I should have gave you your medicine hours ago. And I was like, he's discharging me. I just want to go home. I don't want it at this point. I get there are other people besides me in the ER that is critical, but if you're that busy, you should have a backup nurse, just like you found a backup nurse to stick me. And I'm just done. And then she walks away okay, no, you don't have to have it, but let me come get your paperwork real quick and get your IV out. And she didn't even come back. Then the guy comes in, that's a tech, and was like, that's because they're doing shift change. I said, I don't care about shift change. I don't feel good. My head is pounding. I have not eaten all day. I've not had a sip of water outside of brushing my teeth. But we're supposed to be okay, and we're just supposed to just accept the crappy service that we get at these hospitals. I'm just over it. I told my husband I'm just done. I'm just done with everything. So that is my update.